I'm going to talking about case 38 2015, a 21 years old man with fatigue and weight loss. Definition: fatigue is a subjective feeling of tiredness which is distinct from weakness and has a gradual onset. Unlike weakness, fatigue can be alleviated by period of rest. Fatigue can have physical or mental causes. Physical fatigue is the transient inability of a muscle to maintain optimal physical performance and is made more severe by intense physical exercise. Mental fatigue is a transient decrease in maximal cognitive performance resulting from prolonged periods of cognitive activity. It can manifest as somnolence, lethargy, or directed attention fatigue. Medical fatigue is no specific symptom, which means that has many possible causes and accompanies many different conditions. Fatigue is considered a symptom rather than a symptom because it is a subjective feeling reported by the patient rather than an objective one that can be observed by others. Fatigue is a feeling of fatigue are often confused. Weight loss is a decrease in body weight resulting from either voluntary diet, exercise, or involuntary illness circumstances. Most instances of weight loss arise due to the loss of body fat, but in case of extreme or severe weight loss, protein and other substances in body can also be depleted. Applications in medicine. The patient has been in excellent health, running 3 to 5 miles daily, and competing in sports until approximately 3 months before this admission, when increasing fatigue occurred during the next 6 weeks. His sleep requirement increased from 8 to 20 hours per day. Approximately 2 months before this admission, he was passenger in a motor vehicle accident. After which, he had an exacerbation of chronic back pain that he had previously attributed to sports activities. He was seen in a clinic of another hospital a few days later. A radiograph of the cervical spine was normal. He took no steroidal anti-inflammatory drops, as needed for pain 1 week later. He went to the emergency department of a second hospital because of fatigue, low back pain, and bilateral swelling of the breast tissue. Testing for lyme disease was negative. He was advised to discontinue taking the workout supplements which contain creatine nitrate that he had been taking for several years. The next week, he returned to the second hospital because of worsening symptoms. Test results were reportedly unchanged. A muscle relaxant was administered with active improvement. One month before this admission, anorexia, nausea, no beliefs, no bloody vomit, weight loss, intermittent chills, and anxiety occurred followed by dyspnea with exertion and decreased exercise tolerance. Exercise was limited to walking several blocks before resting. On evaluation in the emergency department of the second hospital 3 weeks before this admission, testing for Lyme disease was negative. Other test results are shown in Table 1. The study was positive for occult blood. An urinalysis revealed trace protein increase in early bilirubin 2.0, reference range 0 to 1.0. And red cells per high power field reference range 0 to 5. Diagnosis of anemic hyperthyroidism were made. The patient was discharged with instructions to see a gastroenterologist and endocrinologist. Pros.
You've been trying to lose weight, and for a while you were on a roll, dropping the pounds like crazy, but lately you just can't seem to get motivated to work out. Maybe you've been eating some things that aren't so good for you. So Dr. Snellgrove from Eastern Shore Weight Loss is here to get you back on track, right? Now there are so many
improved immune system, ability to fight off illness, decreased risks of heart disease. Comes increased risks are for health problems such as heart disease, stroke, some cancers, and diabetes. Worried, tired, exhausted, malaise, listless, lack of energy, and feeling run down. Issue complete in Ecuador. Fatigue is common. About 20% of population claim to have fatigue intense enough to interfere with living a normal life. A physical cause has been estimated to be responsible 20% to 60% of the time, while emotional or mental causes comprise the other 40% to 80% of cases of fatigue. Unfortunately, fatigue can also occur in normal individuals that experience intense physical or mental activity, or both. However, in contrast to fatigue that occurred with some diseases and syndromes, normal fatigue in healthy individuals is quickly relieved in a few hours to about a day when the physical or mental activities is reduced. Also, people occasionally experience fatigue after eating. Something termed postprandial depression, which can be a normal response to food, especially after large meals, and this may last about 30 minutes to several hours. Conclusions. I think that fatigue and weight loss can use discomfort in the person affecting their physical and mental condition and may indicate suffering from a disease such as anemia. But if the loss of weight is not for a pathological cause, it can be really good for the cardiac health and the well being of the person.